Welcome to the Vision Quest video series, a step-by-step guide to holistic health. This program will discuss naturopathy.
My name is Amanda McQuaid Crawford, and I'm a medical herbalist, and I was trained in Great Britain, and I have a degree in nutrition as well, and so I see people for a number of different kinds of conditions, and I also teach a lot of classes and lecture widely.
In this film, we'll cover naturopathy, the origins and philosophy of naturopathy, and also how different naturopathic remedies are used. Naturopathy includes nutrition, homeopathy, herbal medicine, and bodywork such as massage, and many other therapies as well. In this film, we'll also see a session of going to visit a naturopathic doctor. We'll also have a chance to see how different common naturopathic remedies may be used for self-care.
For thousands of years, when it was first known as nature cure, naturopathy has concentrated on helping the body to cure itself by using various natural therapies. Today, modern naturopaths incorporate numerous modalities such as physiotherapy, therapeutic exercises such as yoga, chiropractic or osteopathic manipulation, reflexology, acupressure or massage, acupuncture, hydrotherapies, biofeedback, meditation or autogenic training, corrective nutrition, herbal remedies, supplements such as vitamins or minerals, and homeopathic remedies. Naturopaths also encourage people to think positively in terms of good health rather than pain and illness, and to live as naturally as possible amidst the pressures of our modern world.
Definition of naturopathy, if you have a look at the dictionary, involves the use of water, sunlight, wind, air, and massage. That may have been so centuries ago, but naturopathy's come of age. Now it involves the scientific use of herbs, minerals and vitamins, and homeopathic medication.
In my understanding, I think naturopathy is a way of treating a certain illness through the natural process.
And what would that include?
That would include looking at the person's lifestyle, anything that would be from stress related, understanding one's mental approach, emotional approach to a lot of the issues, and not to say the physical approach. And the fourth one would be the spiritual approach as well.
When, for whatever reason, disease occurs somewhere in the body, naturopathy sets out to identify the underlying cause of the illness rather than just the symptom itself. Basically, disease is thought by naturopaths to have one major cause which correlates to a breakdown in the body's own natural balance. A specific type of disease a person may suffer may be the result of various bacteria, viruses, allergies, or other exterior influences. However, these are only secondary to the importance of an individual's ability to resist that illness. By treating each case individually, naturopaths take into account a patient's total physical, emotional, biochemical, and social makeup in order to find an appropriate remedy. There are three basic principles in naturopathy, including the body has the natural drive to maintain balance and harmony, therefore symptoms are a result of a body attempting to heal itself and return to that equilibrium. The root of all disease is the accumulation of waste, toxins, or bodily refuse due to poor lifestyle habits. And the body contains the wisdom and power to heal itself, provided that what we do enhances rather than interferes with this healing process.
Naturopathy, apart from having studied all the different types of theories and philosophies, the naturopath themselves would work out according to their personality, the way that how they would see things, and also through experience how what they have learned through experience, that they can apply the technique to treat people.
Germany do it very differently. I think Germany have a totally different approach in their healthcare system. Germany have an approach whereby if you're ill, people usually consult a natural therapist like myself first, and then if all else fails, then they consult a medical practitioner. I think most medical practitioners in Germany practice natural medicine to some degree, whereas in what I'd call the Western society, it seems to be backwards, in my opinion. There are certainly circumstances whereby people need to take synthetic medication and or need to have surgery, but I think my opinion is that in a lot of circumstances, a lot of it's unnecessary.
The origins of naturopathy date back more than 2,000 years, when the Greek physician Hippocrates, known as the father of medicine, laid down the principle that cures should work with the body and be as natural as possible.
The origins of naturopathy are, I think it's probably started thousands of years ago, probably more as herbal medicine more than anything else, although homeopathy has been traced back for hundreds, possibly thousands of years. The first use of plants as medicinal agents, I think archaeologists have found remnants of medicinal plants used by, our predecessors, cavemen, if you want to call them that. And it's basically become very refined through thousands of years to now being very scientifically validated.
Modern naturopathy was pioneered in Germany in the early 19th century by therapists such as Vincent Presnitz, who believed that water contained a miraculous healing power. Towards the end of the century, a Bavarian monk named Father Sebastian Kneipp successfully treated an ill American named Benedict Lust. Lust then returned to the US and founded his own particular form of therapy, which today is the basis for modern naturopathy. Most naturopaths believe that their holistic approach to health can help all kinds of people with all types of medical ailments. Age is no barrier, and patients who seek assistance from a naturopath may range from infants to the elderly. Naturopathy is said to be very beneficial in helping to recover from a number of problems such as arthritis, ulcers, inflammation, colds, influenza, diarrhea, and rashes. Naturopathy can also be used to deal with cases which have no medical diagnosis, which may include anxiety or chronic tiredness. As naturopaths concentrate on the individual as a whole, rather than the disease itself, they emphasize that their success as practitioners relies on their patients' own ability to heal themselves, as well as the amount of physical damage caused by a disease. For instance, a young person full of vitality should respond well to treatment for bronchitis, while an elderly, frail person with the same complaint may not get better so quickly. During a session, a naturopath will usually take a case history of a particular patient, including symptoms and their effects on weather or time of day, eating habits, sleeping patterns, work, daily routines, physical factors, and bowel activity. This is usually followed by a routine medical examination of the pulse, heart, lungs, and blood pressure. A naturopathic practitioner may also check spinal joints or other parts of the musculoskeletal system to make sure that they are working freely. Many naturopaths also use various special diagnostic techniques such as iridology, hair diagnosis, blood or urine samples.
Well, usually I have just in the mornings I have just sort of toast and coffee.
In naturopathy, diagnosis is more concerned with establishing why an individual's health has broken down rather than putting a name to a specific disease. For a naturopathic practitioner, the diagnostic findings are only a portion of the assessment that he or she will make. They will also take into consideration other physical, emotional, or environmental factors which influence health.
My philosophy would be I would allow the person themselves to understand what problems or illnesses that they're having, so that through the understanding and awareness of the problem, they in turn can cure themselves. I'm only a tool to awaken that awareness within them.
But apart from just the simple physical symptomology and diagnosis and prescribing, you've also got to take into consideration the emotional and spiritual well-being of people. So a lot of counselling would come into it, and in certain circumstances, creative visualisation for different illnesses also plays quite an important role. But certainly counselling for those emotional hurdles that we come across occasionally, they certainly need to be dealt with. As I think we all know, emotions tend to play a very big role on the physical.
Yes, I would say it is a holistic approach, because it's to say a migraine, when a person is suffering the pain, how can one treat that pain if we don't know what is causing the pain? So therefore we have to look at a variety of issues to find out what is really the cause. So perhaps it could be the food that's causing the pain, or the stress, which is environment, and also there are many aspects.
Most people are frightened of illness, feeling it is something which they have no control over. However, naturopaths attempt to dispel this fear by explaining what the body is telling us when it's unwell. For instance, sudden or severe symptoms are indications that the body is dealing with a particular illness, and therefore the symptoms must only be suppressed if the patient's life is in risk. Rather than suppressing symptoms, naturopaths sometimes see this occurrence as a healing crisis, where the body is attempting to release poisons or toxins within the body. Naturopaths may then adopt changes in diet or herbal treatments. In all cases, care is taken to ensure that any symptoms do not overcome a patient or hinder his or her ability to make a recovery.
If it was just your typical average headache, I'd certainly be looking at several factors there. I'd be looking at the emotional factors that may have brought it on and how we can look at that and change that. I'd be also probably give them a back rub and a massage of the neck and shoulders, and possibly use herbal medicine just to calm them down and calm the nervous system down a little. The use of just gentle old chamomile, a bit of passiflora and scutellaria, skullcap can do that. For more severe headaches like migraines, we're going to look a little more closely at diet, nutrition. The use of homeopathy plays a big role there for the reduction of pain and discomfort.
Regular migraines, particularly when I was studying for exams and preparing for exams. It started off like that. And now I still get the migraines, but it happens, I think, for different reasons. When I get really tense, or it's when I really have a lot of work, or I've got some problems, sometimes it just happens. So I can't predict when they happen, but it's just that it's regular.
Okay. And tell me, Patricia, do you know if you are allergic to anything, any foods and chemicals?
I don't think I'm allergic to any foods, but I try to watch what I eat, although obviously sometimes, you know, I sort of go out and have, you know, a bit of too many good things at once when I go out. But I mean, I guess I do sort of enjoy food, so I think sometimes maybe I just eat too much of one thing when I like it, and I think foods like you know, cheese and lots. I like dairy foods quite a bit, and sometimes chocolate, and I think well, I guess like to have a glass of wine, or especially, you know, champagne from time to time. So that's the sort of food that I eat, but it's not every day. I think I try to keep to eating proper meals, and that means balanced food as much as possible, having vegetables and carbohydrates and some protein.
And the pain in the head, whereabouts is it?
Tends to always be in the front section here, and sometimes it's left, but it's always in the front, and it throbs. It's a throbbing pain.
And would the migraine that you do have, would that be preceded by flashing lights?
Yeah, sometimes I just see black dots in my eyes, and it just feels suddenly like my eyesight starts to get really blurry, and then I start to feel nauseous. So that's how I know that the migraine's coming very soon, and I'm going to feel really sick. So I just have to get up and stop what I'm doing.
What would you normally do on the time when you do have days off or a break?
Well, I like to go for walks and go down to the beach and do some swimming, and try to do that as often as I can, and just having time to relax, where I just don't think about work, and also you know, be with friends doing other things, and going out. So I think it's important that I still keep that up, but it's just not, I think, as easy to say as to do it. So I mean, that's my problem sometimes, that I know I have to do these things, but I don't follow it through.
Okay, Patricia, now I'll just take your blood pressure to see what your blood pressure is like. Just relax. When Patricia came in to see me, she came in with a migraine, but having sort of gone through her case history, she is in a job that is very stressful. And also she was not eating properly or normally, and having a lot of junk food. Now, firstly, her diet was imbalanced, and secondly, the stress of work, and especially with traveling a lot and seeing a lot of, you know, poverty about as well, that would cause a lot of stress. So and she didn't want to have any medication either. She just wanted to find a preventative method for not getting the migraines, and also find a way to manage her migraines. I treated Patricia on the fact that her diet was imbalanced, and also stress related to work. I suggested that she avoided dairy foods, a lot of food that has preservative in it, and to avoid chocolate, because she really likes eating chocolate, and to reduce her coffee intake. She was drinking many cups of coffee, and in work related, I suggested that she does take out some time off from work, exercise by swimming, walking, do some meditation, relaxation, yoga, and I find that by treating her with the acupressure points, that would help to relieve her migraine. I suppose trying to give up the chocolate would be quite difficult, especially in the field where Patricia's coming from and needing the energy when she's not eating properly. So I would suggest, that's why I have suggested for her to take some vitamins and minerals. And for anybody who do have like sweet cravings, especially chocolate, chromium would be the best to alleviate the craving for chocolate. And for her to become more aware of her dietary intakes, sort of having more fiber, more fresh fruits and vegetables, and just eating properly. I feel that it would help her. But there are times when, being mere humans, we would like to have chocolate, and it's all right if it's only once in a while, but not all the time.
I've had people with, as far as children go, glue ear, bronchitis, typical childhood illnesses, measles, mumps, those things. In adults, basically anywhere from the common cold, you know, right through the whole spectrum of illnesses. I see a lot of great results in the use of herbs and nutrition in arthritis. People stumble in and, you know, after a series of treatments, they walk quite well, in no pain or little pain, if any. Your typical bronchitis and laryngitis and respiratory tract infections generally usually resolve, you know, quite quickly, within a week or within sometimes 2 days. Glandular fever is another one. People respond very, very well to the use of herbs and nutrition in the use of glandular fever, and people bounce back very, very well within, you know, just several weeks. And I think most medical practitioners would agree that, you know, they really have little treatment for it, apart from rest and good nutrition. And the use of herbs and homeopathic nutrition in the cases of HIV infected people, these products tend to support those conditions very well.
I had a referral from a specialist, and what this specialist could treat was the physical symptoms, and he thought that by referring her to me, I was able to treat her on the mental and also the physical, which was the massage. The mental was finding out what really caused her to have the pain, which is the polymyalgia, and I feel that she is getting a lot of benefit out of it through massage and also talking of the past, of what had happened to her. Oh, the precaution would be on the herbs. I would say for a person who do not know anything about herbs, herbs can be quite poisonous as well. And also mixing up the wrong types of herbs, and depends on the potency of that particular type of herbs. One has to understand as how much one has to put into a mixture.
And homeopathy, I guess, is the same idea.
Yes, homeopathy is of a similar idea, but it's less toxic than the herbs, the herbs as such.
There's certainly right and wrong ways of doing everything. I mean, a lot of people have the opinion that just because they're natural, they believe that things are safe. But things aren't as they seem to be. Herbs do have minimum and maximum doses and therapeutic regimes that must be adhered to. And the same goes for homeopathy and, of course, nutrition. If you're giving a supplement, you don't give a supplement willy-nilly. There are certain, I suppose, if you want to call them, rules and regulations to stick to for the treatment of different diseases.
So you wouldn't go and advise someone to go and get a book, for example, on homeopathy or...
I'd suggest it if they were genuinely interested, or they were looking at furthering their own educational base, most certainly. But as far as self-prescribing goes, I certainly would not advise that at all. In fact, that's one of my touchy points, I think. I'm certainly not keen on people just self-prescribing and self-diagnosing. I think I see a lot of people in my practice that have been there and done that, and when they turn up at the practice, they're usually in more problems than what they started out with.
I feel naturopathy can help in all conditions, but I feel that the caution that us as naturopaths ought to take would be where there's a terminally ill, condition, where I feel it's important for them to seek medical advice, and also with conditions that that requires orthodox medicine, like kidney failure, and also with any conditions to do with diabetes. Yes, I would suggest that they do have, they do go and see the general practitioners.
There are certainly known side effects with plants and the nutritional supplements, and again, they've got their therapeutic doses, minimum, maximum doses, and certainly there are precautions and contraindications. So there are times when you wouldn't use a particular herb. For example, there are several herbs that you certainly wouldn't use, say, if a lady was pregnant, or there are certain herbs that you wouldn't use in a child. There are certain minimum, maximum doses that you can get away with using in an adult, but you wouldn't use the same formulas, for example, same dosages in children. As far as the medical side of things go, I think there are several medical practitioners around that are at least becoming more aware of naturopathy and what naturopathy has to offer. Personally, I work very closely with medical practitioners. I receive a lot of referrals from medical practitioners. And I have no qualms at all in referring to medical practitioners. Certainly they help me out in lots of ways, in as far as ordering my x-rays and taking any bloods that I require, even though that I can take those things as a nurse. At the end of the day, it's handy for a patient to be bulk billed, for example.
I have a feeling that the medical professionals are changing in how they do see naturopathy. I do have a lot of colleagues who are in the medical profession and who are referring a lot of their patients to me. But then on the other hand, there are also the practitioners who are from the old school who will not accept us.
I was asked this question the other day, and I think I remember one of my senior lecturers actually saying to me that one day people will only ever know, people will only know herbs, nutrition and homeopathy, and I think that day is very fastly approaching.
Oh, I think it'll just go from strength to strength. More people are becoming more aware of what the doctors are prescribing them, which is just medication to suppress the signs and symptoms that they do come to see the doctor. And I feel that a lot of people do wish to talk more about their problems rather than just being given medication to suppress the pain.
I would certainly encourage them to attend a naturopathic practitioner. Certainly, again, when I first went into practice, majority of the people I used to see were people that had tried every other therapy, every other Western therapy available. And they'd come along and have naturopathic treatment, and they'd usually, hit themselves that, or kick themselves that they, hadn't tried it earlier. I'd certainly encourage anyone to see what naturopathy has to offer for them.
Naturopathy is a completely natural approach to healthcare, concerned with the prevention of disease by a means of education in nature care, correct living, eating, and thinking. It encourages the growth of our self-awareness and relation to all things living. This approach promotes the body to heal and cleanse itself on all levels, including emotional, physical, spiritual, and mental. Fruit juices. Different fruit juices may alleviate numerous ailments in the body, including apple, which builds resistance against infection, helps colonic flora, reduces gallstones, cleanses the body, and stimulates digestion. Apricot cleanses the body, builds blood cells, helps eliminate pimples, worms, constipation, obesity, asthma, and gallstones. Banana helps constipation and provides instant energy. Grape provides energy, reduces blood acidity, builds blood cells, helps lower blood pressure, insomnia, or poor complexion. Also strengthens weak digestion and helps combat diseases in the respiratory organs. Grapefruit purifies blood, assists in weight control, eases constipation, helps lower high blood pressure, a sluggish liver, or gallstones. Lemon, good for the gout, rheumatism, arthritis, has a laxative effect, purifies blood, helps jaundice, obesity, and has a liver corrective effect. Orange assists in bone and teeth formation in children, prevents rickets, cleanses the blood, assists in combating fevers, flu, anemia, asthma, bronchitis, infections, high blood pressure, diabetes, and arthritis. Peach purifies blood, helps anemia and high blood pressure, assists in alleviating gastritis, bronchitis, asthma, obesity, or weak digestion. Pear can be used as a mild laxative, helps constipation, weak digestion, high blood pressure, obesity, skin eruptions, or colitis. Pineapple helps digestion, normalizes menstrual function, helps infections of the throat and chest, asthma, high blood pressure, and colitis. Plum, natural laxative, digestive aid, alleviates constipation, obesity, or skin eruptions. Prune helps anemia, low vitality, sore throats, or constipation. Raisin, rapid revitalizer, helps anemia, low vitality, sore throats, asthma, blood pressure, liver disorders, menstrual cramps, and diarrhea. Raspberry purifies blood, good for invalids, convalescents, and those who are anemic. Strawberry helps complexion, mild laxative, acts on kidneys, and a good tonic for the glands and nerves. Alfalfa improves resistance to infection, helps blood and heart conditions, artery troubles, and respiratory problems. Asparagus helps kidney dysfunctions, glandular problems, diabetes, and anemia. Beet, a solvent for calcium deposits which can lead to hardened arteries, varicose veins, high blood pressure, and heart troubles. Cabbage helps obesity, good antiseptic, helps gum infections, constipation, and skin eruptions. Carrot normalizes the system, promotes appetite, improves bone structure in the teeth, fights infections of eyes and throat, tonsils, sinus, and respiratory organs, protects nervous system, increases vitality, increases mental power and eyesight. Celery helps rheumatism, gout problems, all arthritic conditions and dysfunctions of the nervous system. Cucumber helps high and low blood pressure, teeth and gum afflictions, split nails, hair loss, and skin eruptions. Garlic, valuable cleanser, helps entire system by stimulating appetite, dissolve accumulation of mucus in the bronchial tubes and lungs, rids body of poisons through skin pores. Lettuce, good revitalizer, builds up muscle fibers, nerve centers, brain cells, and lung tissues. Parsley, good blood cleanser, natural diuretic, allays fever, effective in dropsy. Radish, heals and soothes mucous membranes, cleanses mucus from the body. Spinach eases constipation, valuable in duodenal and other ulcers, degeneration of nerves, arthritis, and boils. And tomato neutralizes acid conditions, purifies blood and skin problems, good for cases of congestive liver and jaundice. The following is a list of herbs used for common ailments. Acacia gum, used as a demulcent, often used to relieve catarrh and chest complaints. Angelica, used for rheumatic diseases, catarrh and asthma, also used as a stimulant and diaphoretic. Bayberry, used as a strong stimulant, warming and cleansing the body, also used as a poultice for ulcers. American bear's foot, used for quick pain relief and as a gentle laxative for the aged. European birch, used to soothe skin disorders. Bitter root, used as a cathartic and heart tonic, also used as a powerful emetic and diuretic. American boxwood, used as a tonic and stimulant, also used as a remedy for migraines and headaches. Buchu, used for urinary and bladder troubles, also used as a diaphoretic and stimulant. German chamomile, used as a nerve sedative, carminative, and tonic, also used as a poultice for leg ulcers. Chickweed, used as a stimulant and carminative, also compounded with other remedies. Comfrey, helpful as a treatment of internal ulcers for rheumatic pains and arthritis. Dandelion, used as a tonic and diuretic and for liver and kidney ills. Echinacea, used as an antiseptic and to help purify the blood. Figwort, used as an emollient and demulcent and as a poultice for ulcers. Garlic, used for the treatment of dyspepsia and flatulence and also as a stimulant. Ginger, used as an expectorant and as an aid to digestion. Golden seal, used for skin and gastric disorders. Hawthorn, used as an aid for heart conditions. Irish moss, used in cough medicines for its demulcent properties. Lavender, used as a carminative and stimulant, used for depressive headaches. Marigold, used as a stimulant, diaphoretic, and anti-inflammatory. Nutmeg, used as a tonic and as a mild laxative. Parsley root, used for rheumatic problems. Pennyroyal, used as a reliable treatment for obstructed menstruation. Peppermint, used to relieve sickness, flatulence, and indigestion. Raspberry, used for painful periods, easier childbirth, and gargled for sore throats. St. John's wort, used for coughs and bronchial ailments. Slippery elm, used as a nutritive for invalids, also as an emollient and demulcent for healing burns and skin troubles. Thyme, used as an antispasmodic and tonic, also used as a strong antiseptic, useful in irritable coughs. Valerian, used for relieving nervous tension. Vervain, used to help depression and tension. Wild indigo, used as an antiseptic and stimulant, used externally for ulcers and boils. And wild yam root, used for leg cramps and intermittent claudication. The following is a list of ailments and their corresponding homeopathic remedy. Abdominal pains lasting several hours, boils, bronchitis, common colds and influenza, coughs, cramps, diarrhea, earache, mental exhaustion, physical exhaustion, headaches, heartburn, sciatica, sore throat, thrush, and vomiting.